We had a recess until 11 o'clock. I'm calling an end to the recess. Okay, do you want to?
Sure, call the roll.
Commissioner Thayer?
Yes.
Commissioner Richardson? Commissioner Schroeder?
Here. Mr. Chair, I'd like to make a motion that we convene as the Board of Health for our quarterly update.
Second. Please vote. Aye.
Aye.
You're on.
Thank you, Commissioners. Good morning, everyone. Dwayne Smith, Public Health Director. Good morning, citizens listening in and staff and guests here this morning. Here to give a quarterly update on the status of the Public Health Department. Our agenda, we have one administrative request, staffing update, some brief data updates, an update on our progress with the primary care clinic and environmental health, vital records, and some health promotion highlights. Again, setting the foundation with our public health services. We are currently engaged in assessment and planning, communications. We delve slightly into policy support, policy development by weighing in with perspectives, particularly on issues that would benefit from a rural public health perspective. We are engaged with community partners. We are focusing on organizational competencies, and today we'll highlight emergency preparedness and response. What is required by the health department? What's mandated under state statute, and what are our department's expectations to preserve the health, promote health, protect the environment of our community? So we have to have a Board of Health, which you all are serving as today. Myself as Public Health Director. Our Public Health Medical Officer is Dr. John Duvall. We have to have staff to perform the required activities, and we have the fund balance. We have to conduct core public health services. Every 5 years we have to do a community health needs assessment, which we did last year. We have to do a subsequent public health improvement plan, which we're in the midst of. We have to do birth certificates and death certificates, which are part of vital records. We have to review every child fatality that occurs within the county of children age 18 and under. We are mandated to refer those that are characterized as preventable injuries. Maybe a car crash, maybe a violence-related issue like a shaken baby syndrome. We also review those that are not required that may be a result of congenital anomaly, where an infant or child had a terminal condition, just to try to identify opportunities to prevent them from happening in the future. And we have to do septic tanks. We have to do communicable disease surveillance and control, maternal and child health, chronic disease, injury prevention and behavioral health promotion, again, vital records, child fatality review, and septic. Those are under the must conduct. I should have made that distinction. We can delegate out retail food inspection, although we do that. We don't have a whole lot of restaurants in the community, maybe 16 or 18 restaurant inspections annually. Those typically occur during the first quarter, 2 quarters of the year. And we also do child care facility inspections, again, of which we only have a handful. So transitioning to the per capita allocation, the Public Health Act of 2008, which was intended to improve performance of the statewide public health system, specifies that each community in Colorado should provide high-quality public health services regardless of its location, focuses on a strong public health infrastructure and the need, and that's a shared responsibility between the state and local public health agencies. and our partners. As you'll see in our staffing update, we do receive quite a bit of funding from the state of Colorado. That's allowed us to add a couple more positions. Defines the duties, as I previously spoke to, of a public health agency. Establishes minimum qualifications for directors and core public health services, and minimum quality standards. Typically that has to do with surveillance, reporting, everything from communicable disease to septics, vital records, and so on. And establishes a funding formula for allocating support, financial support to the county and the district public health agencies. So I think I've showed this before, but here's what we have. We've added emergency preparedness coordinator this past quarter. We've long had an environmental health specialist, that's Stacy Reinhardt. Last year, we posted a position for an epidemiologist. Probably worked out best in the long run that we did not fill that. That is, when we need it, we need it. We needed it during COVID. Now, during a lull and a relative period of calm and healthy community, I don't know that we could keep that role sufficiently busy. So future needs, we may simply look at contracting that out. We hired a health educator in November of 21. I fill the role as the health planner. And for context, generally speaking, the role of the health director is as the chief health strategist for the department, identifying need and opportunity and things like that. We do not have a nutritionist. Nutritionist is required for the Women, Infants, and Children's program so that they can do the dietary assessments of the women and children. However, we have addressed that need through a partnership with Douglas County Health Department, who provides WIC services on our behalf, and their nutritionists do the nutritional assessments as needed. And we have Sarah McIntosh as our public health nurse. So looking at the history, in 2008, with the inception of the requirement for the local per capita support, per resident support, it was at $1.50. That's the statewide minimum. The amount has remained unchanged over the last 15 years. Our allocation in county funding in 2022 was a little over $37,700. We wish inflation remained constant, but it doesn't. Inflation nationwide, per the American Institute for Economic Research, has increased by 36%. Looking at our county census population estimate of not quite 28,800 residents, beginning with next year's budget, I am here to respectfully request a per capita allocation that's aligned with the rate of inflation. So that rate of inflation, with a 36% increase over the last 15 years, would take that per resident allocation from $1.50 to $2.04. That is a total increase based on 27,799 residents of $19,046. That would be additionally requested from the county budget, and that would put the new request at $56,709.96. So what do we get for that increase? We continue to operate our staffing profile in Elbert County at a level that is lower than the Eastern District average. And you'll see the asterisk there, the 10 counties that are represented in the Eastern District, their average staffing model is 18 FTEs. Among those small agencies that serve a population less than 50,000, the staffing average is 11 FTEs. We're doing that at 7.75. That 0.75 includes .25 for each of our nurse practitioners, our family nurse practitioner, our pediatric nurse practitioner, plus our case investigator and contact tracer that during COVID was basically a full-time role, and now during calmer times has dialed back to a .25. The other 7 FTEs are the folks that are here Monday through Thursday. So with that information, I'll be happy to answer any questions regarding this request.
So you have to bring me up to speed exactly how all that would work. So it would be a transfer from the general fund to the public health fund?
Correct.
Now, have you been working with Sean with respect to the budget items?
Yes, our budget has been submitted. Teresa and I worked on that. Haven't heard any feedback about any concerns. So I think the last we were told is if there were any concerns with your budget, we'd call you in, and haven't been called in for any questions. So hopefully that meant everything was okay.
Yeah, well, where I'm going with this will be a budget item, and it'll be either approved or not approved as we handle the whole budget.
Yes, understood.
So what specifically would the extra $19,000 do for the department over where you're at now?
It allows for growth. The growth, and I'll speak to that in our clinic services. Our costs are going up as we increase our patient volume in the primary care clinic. Everything from supplies, diagnostics, staff time, and so on, proportionally. And I'll speak to, and I can jump to that if you like, kind of the increase in revenue as we increase our patient volume, our client volume in the clinic.
We'll get to it when you're ready.
Okay.
Just go ahead and follow your slides.
Okay. So by way of a staffing update, in July, we brought on board Teresa Claus as our finance and grant specialist. This is a position that we're backfilling after having been vacant for, I guess since September of 2020. Teresa comes to us from, I guess most recently, University of Colorado Health. Teresa, will you stand up, please, and say hello?
Very good. Welcome.
And in addition to keeping track of the many grants and financial reports and monthly variance reports, and working on the budget, Teresa has a background in marketing and communications, so we're going to tap into that experience with her as we continue to ramp up our clinic marketing communications as well as our typical health promotion activities. And then earlier this month, we brought on board Juliet Madsen as our Public Health Emergency Preparedness Coordinator. Juliet's funded through the Public Health Emergency Preparedness Grant from the state, as well as the city's Readiness Initiative. Juliet comes to us from the Behavioral Health Response Team. Did I get that right at CDPHE? Disaster Behavioral Health Response Team. And Juliet is accompanied by her service animal, Butch. So Juliet, will you please stand up and share any comments?
You need to go to the speaker so that it can be heard online.
Hello, I'm Juliet Madsen. I did 5 years at Colorado Department of Public Health on the Disaster Behavioral Health and Fatality Management team. And before that, I did over 25 years in disaster response, and I'm a retired United States Army. It's nice to meet you.
Thank you.
Thank you.
Welcome.
Thank you, Juliet. Juliet is working on Emergency Support Function 8, for which there is a laundry list of responsibilities. This position will be working in concert with our Office of Emergency Management and Shane Pines and his staff member Aaron. If it's, I'll just say, for lack of a better term, a garden variety emergency event, it's in support of Office of Emergency Management. If it is a public health specific emergency event, that would include obviously things like COVID, which I hope we never have to tap into that again. Another communicable disease outbreak would be more likely measles, something like that. Anything to do with water quality, air quality. That is Juliet's focus. So Emergency Support Function 8 is one of 15, sometimes 16, depending on the county, emergency support functions through the Department of Homeland Security Emergency Management. Is that how that works?
Correct.
Thank you. Both Juliet and Teresa are located in the Health and Human Services building on the south side of the building. Oh, actually, I did include a slide on ESF 8. And I won't run through each of those, but there's a lot of them. Questions about any of that? I'm just going to pause there.
I assume that takes a lot of coordination, of course, with the OEM office on who's taken the lead in a certain event. So I'm going to say like a toxic accident on I-70 that has potential for a spill would fall more under your purview with support from OEM. Am I reading that right?
Most of it Shane will run, and I will do mass care sheltering services.
Okay.
That's where my expertise falls.
Okay. Thank you.
And we just did have a conversation about that in light of the train derailment down in I-25 in Pueblo. Obviously, we do have a portion of the northeast part of the county where there's rail lines. That is a Union Pacific line. Juliet's reached out to UP to inquire about what do they haul across those lines. Is it coal? Is it other, toxic materials? Is it, garden variety supplies? So, but yes, to answer your question, it may depend on what spilled as opposed to the spill itself. So, by way of a data update, in looking at the most recent update on Elbert County from the State Demographer's Office that came out maybe 2 or 3 weeks ago, I just wanted to share our age. This first slide is by standard age category and percentage of residents in each age category. And then I'll toggle back and forth. You can see the comparison, how we skew older, which we've all known this, but it's sometimes nice to see it in visual format. We skew older than the statewide age profile. And then this third one is just volume, not percentage, of folks in each age category. One of Juliet's functions is going to be addressing access and functional needs in the event of an emergency. So, and I honestly don't recall where I got this data from. It was probably from the state. And these are estimates, but of our roughly 27,500, 28,000 residents, more than 8% of our residents have some type of disability. That amounts to over 2,100 residents, which is a significant volume of residents. You can imagine if there was an evacuation or relocation needed, especially in the more population-dense area, It's going to be a significant lift to support relocation for those residents, all residents in general, but certainly those residents that have access and functional needs. So this is just the tip of the iceberg in terms of better understanding the size of the challenge. Okay, transitioning to clinic updates. We continue to make progress. This past quarter, July, August, September, for the period July 1 through September 30th, we served 141 clients. That was up significantly. There's the breakdown of adult and child clients. There's the more than 24 immunizations. Sarah has provided respirator fit tests, and this was to the nursing facility in Elizabeth called Pearl Street Assisted Living. I would just call this a value add to that care provider that we can offer. Do you want to give a quick explanation of what the respirator fit test is? I want to do it justice.
Sure. Nope, you're fine. So a respirator fit test is for medical facilities and anybody that might be exposed to a contagious disease or bacteria. And honestly, police departments might offer it as well as far as particulate stuff. So anybody that wears an N95 should have it fit test to their face annually to make sure that no particles are getting in through the side for it to be truly effective. So it's something that all medical facilities, nursing homes, hospitals are required to do annually. So without someone there to perform the test, I was able to help them out.
And that keeps the resource local so that the nursing facility doesn't have to contract with somebody in another county and most likely pay more. Continue to conduct pre-employment drug screenings, and again, we are a lab draw site for Quest Labs. We can do any lab work locally and send that out, including pre-surgical procedure lab work, and hopefully make that more convenient for the folks rather than having to travel outside the county. Continuing to do tuberculosis tests and COVID tests among incarcerated populations in the jail. And looks like we did one separate from that. So our revenue, we had a quarter of growth, I guess is an easy way to say it. We began billing TRICARE, military insurance. We began collecting co-pays for folks that are uninsured or underinsured. We made good progress with Anthem Blue Cross Blue Shield. What did we do with the town of Kiowa?
Drug testing.
Oh, drug testing, okay. And Pearl Assisted Living, and significant progress with Medicaid and Medicare. So almost $6,900 for the quarter. Year to date, a little over $9,000. The first several weeks of October, we continue to be steady. I don't want to say it busy right now, but steady, particularly with vaccines for children. That is a new resource and program that Sarah has established this past year, where we encourage folks with kids that may have lagged on their childhood vaccinations during COVID because it wasn't convenient to get to annual visits where they got those vaccinations, that we can take care of them locally. Transitioning to environmental health, 435 permits issued year to date. There's the breakdown of our new permits, repair permits, and just use permits. As a result of the rains and floods in June, we are down for the year in inspection volume and resulting revenue. In a typical year, our 12-month revenue will hit 160, 165,000. In a boom year, we'll hit 180,000. We're not going to hit that this year. Not much we can do about that with the floods. So we will fall short of that. We should be able to cover, the revenue should be able to cover staff salaries for environmental health, which is Stacy and Marissa. Food license revenue is nominal for the quarter. Again, most of that is collected in the first and second quarter of the year as restaurants and food trucks get their inspections completed at the beginning of the year before the food trucks go out for festivals and whatnot. So, and you'll see our year-to-date volume on inspections. Again, I'll draw your attention to June, where we took a hit. We're only able to do 10 inspections, whereas we typically hit in 30-some range, or close to it anyways. And the rest of the year is going to be dependent on weather. October's been steady, perhaps busy. And there's the revenue. Biosolids applications, just going along as typical. 7 applications during the quarter, all in the same places. Our vital records, this is really an area of progress and success. As more folks understand and know that we can issue vital records locally, they don't need to go to another health department. And we've also been benefited from the postmasters, folks that come to the post office for passport that need to show a birth certificate. The postmasters have been referring them to us, which is, again, convenient for folks just to run over to the health department and run back to the post office in Kiowa. And the vital records, how long would you say it takes to issue a vital records? 30 minutes-ish? So, yeah. And that is a collaboration. Sarah is a vital records registrar. Lisa is, and Marissa is. Health promotion updates. As I mentioned, Juliet started on the emergency support function number 8 for public health and medical services. The WIC program. Again, I'll put out a call to anyone listening that we want to be able to offer the WIC program, but we need folks to call us and let us know, or at least inquire to see if they're eligible for that. Again, this is nutrition counseling, food support. I think they occasionally have diapers, breastfeeding support for new moms, and it's a resource for the asking for folks that qualify. We are searching for a new location. We had Douglas County Health Department WIC staff come out through August. I think we only had 2 folks in those 8 months, and those 2 were brought in by our Nurse Family Partnership nurse, who were NFP clients. So the WIC program is a core public health function. Again, it's there for the community, but we need folks to avail themselves of the resources. Otherwise, we may have to look at discontinuing the ask of Douglas County Health Department to come out, because it is a cost to them to bring out a couple staff members for the day and their supplies and things like that. So that doesn't mean that local folks would not have access. They could still go to Castle Rock, to Douglas County, WIC office. It's just not convenient. We want to make it as convenient as we can. So we're trying to locate a location in Elizabeth currently. That's our focus. Continuing on with the Douglas County Health Department collaboration, they have hired a community health educator to do the tobacco education and prevention program. That program is funded through state tobacco taxes and the per pack and I guess per carton tax that smokers pay when they purchase tobacco products. Jenny will be and has already been connecting with schools to do the community tobacco prevention education with youth. The focus is preventing tobacco use in the first place, but there's also a component for smokers that can assist with attempting to quit smoking. And I was going to say most people, nobody's going to quit smoking, you know, very rarely, I should say, cold turkey, and like they quit once and they're done forever. They will quit and go back to smoking and, you know, quit again, and there's a cycle of change until we get to the desired behavior. So this program can assist folks, and and I should know it, but I don't off the top of my head, there's a statewide tobacco quit line that any resident can call for support and assistance on how to quit and gradually taper down their tobacco use. We continue to do weekly updates. We continue to write columns for Ranchland News. I want to say October 12th, there was a Violent Blood Drive, and we had how many pints donated? 19, 20? Yeah, so that's continuing our quarterly opportunity for folks to donate blood. Last year we did a 365 health fair. We were planning on doing one again this October. However, their 365 Health is a nonprofit. They dissolved in maybe early September and ceased operations after 40 years. So unfortunately, we weren't able to host that health fair. However, we would encourage folks to just call the health department. A lot of the resources and services at the health fair we can do locally here at the health department. So, and that's of course a year-round resource, so folks didn't have to wait until health fair comes around. So transitioning to deaths by suicide, last quarter Commissioner Richardson asked me to share some data, which I want to thank Coroner Sandy Gray for providing this data to me. I know she had to do some digging. She gave me the last 10 years worth, including 2023 year to date. During that 10-year time period, we had 77 deaths by suicide in the county, predominantly male. The average age was about 48 years, and also the mean age was 48 years. So half of the deaths were below 48, half of the deaths were older than 48. The mechanism of death predominantly is gunshot wounds. So that's a good segue to our behavioral health survey. Recall that last year in our community health assessment, the community identified 3 priorities, those being access to care, behavioral health, and healthy aging. Following up on that in an attempt to get a better understanding of, when you say behavioral health is a priority, a health priority in the community, what does that mean? So this survey was developed in partnership with our contractor, Mora Proser Consulting. This survey is currently open. We say it takes less than 10 minutes. Most folks, it takes about 5 minutes. It's not a whole lot of questions. It's not invasive at all, but we do need citizen feedback. And also, if you work in Elbert County, maybe live in another county but work in Elbert County, there is an option. One of the first questions is, do you live in Elbert County, do you work in Elbert County, and you check the appropriate box. So we certainly want feedback from those folks as well, and we can stratify the responses by resident or non-resident. The survey can be accessed at that URL or by scanning the QR code there. This will help us help inform what role the health department can or should be, or what residents want us to play in terms of behavioral health. There are no wrong answers. If folks were to say, for example, we really need another behavioral health provider, or can you do telehealth for folks that can't conveniently access a provider by coming in person, or I don't feel comfortable coming in person. Those are the things that will help inform our strategies moving forward. Survey will be open for another couple weeks. There is an option to check if you are a military veteran so that we can stratify responses by veteran response as well. On this particular survey, it is for 18 and older. So one of the first questions, I believe, is, are you 18 or older? If you check no, the survey ends there. We will push out the youth survey in the next few weeks. And, the other component of the assessment is key informant interviews that the contractor is doing with various school folks, human services staff, professionals in the community, to get their qualitative feedback on behavioral health challenges that they see for the clients that they serve. Lastly, I want to touch on, again, this is an evergreen topic. If folks have any concerns about any public health related issue, whether that's maybe they think they have a rabid animal on their property, or maybe they had an unpleasant reaction after eating at a food establishment, well issues, and so on and so forth. Folks discharging raw sewage on their property has elicited a few complaints. Unpermitted septic systems, please call us. Actually, let me rephrase that. Please go to this link and report a concern. This link's on the county website. That initiates our awareness of a concern, and we can connect with the appropriate department at the county. Sometimes it may be the building department, sometimes it's us, sometimes it may be a legal issue that we need to coordinate with the sheriff's office. So, and then actually I was mistaken, that's not the last thing. So, Commissioner Schroeder, you had teed up potential question about water and agate, the water district in agate. So what I can share, every communication with water quality that the state handles, I get copied on. I just print out the communication, file it on, let me back up to the beginning of the quarter. Make sure I've got this right. I think y'all and many folks that may be listening are familiar with the challenges that Agate Water Association is experiencing with regard to their wells and their tanks, I think, which were put in probably in 1972, so they're better than 50 years old. Their client base is very, very small. I want to say the water district serves maybe 145-ish clients, and maybe 90-ish taps. They are in need of new infrastructure. So on June 16th, Tanya McBride, who is the contact at Agate Water Association, received a letter from CDPHE's Water Quality Control Division regarding a sanitary survey that was performed on May 17th. This is several pages long, and I'll leave a copy of this for you all to look at. A response was necessitated I'll just read it. The supplier must provide a written response documenting resolution of all significant deficiencies and violations, and/or propose a corrective action plan with a corrective action schedule as required by state statute that's cited. On August 8th, they received a subsequent letter entitled Notice of Failure to Correct a Significant Deficiency Identified During a Sanitary Survey. So that was pursuant to the June 16th letter. Again, not pointing the finger at Agate. They're doing what they can. They just don't have the resources. So I don't have a good answer other than they need money. I know Mark Dettenreader in Economic Development has been in conversation with them. I think they had applied for maybe some grants. I'll defer to his historical knowledge of those processes. So I'll pause there with any questions I may be able to answer about the Agate situation.
Yeah, Mark's been working with us and keeping us appraised of the situation as well, and I appreciate the forwarded emails that you get from CDPHE. It is a concern for that quality of water in Agate, and so I believe they now have an actual functioning board at Agate.
I understand, yes.
Kind of like step one, and so hopefully they can move forward and get some of that grant funding. I know Mark was working with them and trying to get some of those funds lined up. But just was curious how CDPHE is going to approach them if they're unable to do any corrective action.
You know, it may have been early 2021 when we had a conversation with the previous water board, the Agate Water representative, and the previous county manager with CDPHE, and they had imposed a fine, and it was kind of an attempt to get blood from a stone analogy. I think they were being fined maybe $2,000, and they don't have that. So I don't know to what extent it may be of value for the Board of Health to write some letter of support. I don't know. I'm just kind of brainstorming and explaining from just what we're talking about. There are no resources. You can't continue to find someone. What's the reasonable plan of action moving forward? So, like I said, I wish I had answers. I don't. So.
I guess my concern off the bat would be, would CDPHE have the authority and ability to say that that water supply can no longer be used and it has to be brought in to the residents there?
I think that's always within the potential realm of possibilities. That's kind of a doomsday thing, but yeah, I mean, that could happen, I think. I don't foresee it. Again, absent torrential rains like we had in June that dramatically affect supply, water quality, things like that. So that's one of the things that's going to be on Juliet's plate, is having a plan B or a plan ready in the event that water is needed to be brought in the event of a, situation.
I certainly didn't mean to put you on the spot on this.
No,
but
it's-
It is something I think we need to keep at the forefront and continue to be aware of.
Yep.
Thank you.
I also do want to point out, I get many communications. So there's probably 25 or 26 water districts in the county. Most of them are operated well. Others are kind of in need of more timely communications to their clients. Some of them are simple. For example, communicating the results of required periodic testing on, content of the water, mineral content, and things like that. Others deal with development issues. So it is something we monitor. Of note, we did back on August 24th with the Prairie Water District, which is Overland Estates up on 86 towards Elizabeth. They had a pipe break, and we found out about it. I found out about it from a phone call from a resident in the neighborhood. I should not be finding out about a break from a resident. The water district manager should be communicating with us. Upon further understanding of the situation, the water district, and this is per conversation with one of the residents, maybe two of the residents, they had not received a water bill in at least a year and a half. There was one property that was sold, and the seller had to put money in escrow for the water bills that would eventually drop for the purchaser, so that they didn't get stuck with a year and a half's worth of water bills. Those are the types of situations that should not be happening. So to the extent that we can, and hopefully this is something we can have Juliet work on as well, we will be paying closer attention and reminding water district managers that are not the greatest communicators with their clients of the need to, meet at least minimum standards. Like I said, most of them are managed fine, but like a lot of problems, it can boil down to communication and timely communication. And folks just want to know what's going on. So as a reminder, for anyone listening out there, if there is a infrastructure issue, a water break, where the county emergency management office and emergency support functions for public health need to get water to a town or a neighborhood or a district, we need to find out about it sooner rather than later, because marshaling the resources, depending on the size of the resources needed, is a significant lift with many different agencies and jurisdictions from the state level on down to municipal or neighborhood level. So there's our contact information. Folks can always call me, email me. They can also email general questions to publichealth@elbertcounty-co.gov. We do post a lot of updates on Facebook and have just begun communicating them via the Nextdoor app, particularly the behavioral health survey. And that's all I have. So I'll entertain any questions, comments.
The only comment I have is those water districts, a lot of them are in special districts, which really don't have a management except that once a year report that they have to send out. And so I think that's part of the communication issue.
I think they should have a contractor, a water engineer on contract that has to respond, I'll just say, in a timely manner when there's an issue. We experienced that with the Elbert community, and I want to say it was a pump failure. I don't think it was a line break. I think it was a pump failure back in August, maybe. And the engineer was there very quickly, and they fixed the problem pretty quickly, and I can't, did we find out from the school? School was not in session. I forget how we found out, but through the grapevine, in a perfect situation, the contractor, has our number and calls us, and we're in the process of collecting all the cell phone numbers for the water engineers.
I asked mine during your presentation, so I'm good.
I have no questions. So are you satisfied that we'll call an end to the Board of Health meeting?
Am I satisfied about?
Are you done? I think is what.
Oh, yeah, I'm,
Okay.
team, anything to add? Okay, no, I'm done.
I've got to learn how to ask better questions.
We appreciate it. Thank you for
Thank you.
your time bringing your folks. Mr. Chair, I would like to make a motion that we close the Board of Health meeting.
Second, may I have a vote?
Aye.
Thank you.
Thank you.
Do we need to recess? We're back at the Board of County Commissioners meeting, which will announce a recess until 1 o'clock this afternoon.